Welcome to In the Know Medical Imaging, where we explain medical imaging in a way that's easy to understand. Your doctor just ordered a CT scan, and now you're wondering, is it safe? Will it hurt? Do I need contrast? Should I be worried about the radiation? If it's your first CT scan, those questions are completely normal. In this video, I'll walk you through exactly what happens before, during, and after a CT scan, explain why each step matters, and hopefully take away some of the uncertainty. CT stands for computed tomography. Think of it as a very advanced X-ray that takes hundreds, sometimes even thousands of images from different angles. A powerful computer combines those images to create incredibly detailed cross-sectional pictures of your body. Doctors use CT scans because they can quickly see bones, organs, blood vessels, lungs, and many other structures that aren't visible on a standard X-ray. CT scans are commonly used to investigate pain, injuries, infections, cancer, strokes, internal bleeding, kidney stones, and many other medical conditions. Every CT scan has a specific clinical purpose. Your doctor isn't ordering the scan just because it's available. They're looking for information that will help diagnose a condition, monitor treatment, or decide on the best next step in your care. Depending on your situation, your CT scan may focus on one area, like your chest or abdomen, or several parts of your body. Preparation depends on the type of CT scan you're having. Some scans require no preparation at all. Others may ask you not to eat for several hours beforehand, especially if oral contrast will be used. You'll usually be encouraged to continue drinking water unless you've been told otherwise. Most medications can be taken as usual, but always follow the instructions provided by your healthcare team. If there's any chance you could be pregnant, tell your healthcare provider before the scan. If you had a previous reaction to CT contrast or have significant kidney disease, make sure your imaging team knows before your appointment. When you arrive, you'll check in and answer a few safety questions. If your scan uses contrast, the technologist may review your medical history and place a small intravenous line, often called an IV. You may also be asked to change into a gown if clothing or metal objects could interfere with the images. Your technologist will explain exactly what to expect before the scan begins. The CT scanner is a large donut-shaped machine with an opening in the middle. You'll lie comfortably on a table that slowly moves through the scanner. The scan itself is painless. Patients don't feel anything from the X-rays. If you're receiving contrast, you may notice a warm sensation throughout your body or a metallic taste in your mouth. These sensations are common and usually disappear within a minute or two. During the scan, you'll hear the technologist speaking to you through an intercom. At certain times, you'll be asked to hold your breath for a few seconds. This helps reduce motion and produces sharper images. Many CT scans are completed in less than 10 minutes, with the actual image acquisition taking only seconds. Have you ever wondered why we ask you to hold your breath? Even tiny movements from breathing can blur the images. Holding your breath for just a few seconds helps produce clearer pictures that your radiologist can interpret more accurately. You may also wonder why the technologist leaves the room. That's simply for radiation safety. We can still see, hear, and speak with you throughout the entire examination. The table also moves very precisely because the scanner is collecting images from many different locations inside your body. One of the most common questions patients ask is whether CT scans are safe. CT uses X-rays, which means there is exposure to ionizing radiation. However, every CT scan is carefully justified. The medical benefits of obtaining important diagnostic information usually far outweigh the small potential risks associated with the radiation dose. Modern CT scanners also use advanced technology to keep radiation doses as low as reasonably achievable while still producing high-quality images. For most CT scans, you can return to your normal daily activities immediately. If you received contrast, your healthcare team may recommend drinking extra water afterward, unless you've been given different instructions. Your images are reviewed by a radiologist, a physician who specializes in interpreting medical imaging. The radiologist sends a report to the healthcare provider who ordered your scan, and they will discuss the results with you. Here are 5 tips from someone who's worked in medical imaging. Arrive a little early. Wear comfortable clothing. Don't hesitate to ask questions. Follow the breathing instructions carefully. And remember, your technologist is there to help you through the entire exam. Hopefully this video has helped you feel more prepared for your upcoming CT scan. If you found it helpful, consider subscribing to In the Know Medical Imaging. We publish new videos every week that explain medical imaging in a clear, practical, and easy to understand way. Thanks for watching, and I'll see you in the next video.